Hi, and welcome back to the Perio Patient Podcast. This is a podcast that I, Dr. Ben Young, periodontist in San Antonio, Texas, put out for primarily my patients or patients who have seen me in the past, but it's open for anybody who is a patient, dental patient, that's interested in these sorts of things. If you've listened to earlier podcasts, you have an idea of my background in dentistry. Today, I'd like you to come back with me to the freshman year of dental school. We are sitting in a large lecture hall located in the basement of the dental school. It is the basement only in that it is a little below ground. There are no windows, and there are no rooms that I know of that are lower than this level. The facility is modern and it's well lit. And it's comfortable with chairs and large dental laboratory classrooms where we will accomplish our hands-on work. There are TV monitors overhead so instructors can televise objects and procedures in one part of the room, and we can look up wherever we're seated and see what they're doing. At the time, this was in the late 70s, it was all pretty cool. Today, it's probably would look pretty old. But I'm sure they've updated since I was there, and it's all digitized and all the rest. We oriented as a class of almost 100 students, and by the time 4 years passed, we knew each other very well. But this is the first quarter of the classes, and the subject is tooth anatomy. This is the class where every tooth is described in detail, and there is a lab attached to this lecture series where we will create teeth in wax. In later courses, teeth we wax will be turned into crowns and bridges through a lost wax casting method. Much of this has changed today. A lot of it is done by dental laboratory technicians. But you have to start somewhere. And these are the basics. And right now, as newbies, we don't know any of this is going to happen. We just are there listening. In fact, we don't know one tooth from another, just like most of you listening right now to this podcast. So we're going to change that. Here are some of the things I learned, and I think might be helpful for you to know a little bit about. It's something to basically appreciate about the artistry and amazing aspects of the human body. So I'm going to share with you what we see just in teeth. The number of baby teeth children have, which are also referred to as primary or deciduous teeth, are 20, 10 on the top and 10 on the bottom. They will be replaced by what we call the permanent or adult teeth as they erupt or grow into the mouth. We have front teeth and we have back teeth. And the front teeth have different jobs compared with the back teeth. There are 12 front teeth, 6 on top and 6 on the bottom. And this is true for both baby teeth and adult teeth. As I said, the baby teeth are called deciduous teeth, because these teeth are going to be shed just like leaves of a deciduous tree. And because this is the case, each of the front teeth that a child loses will be replaced by a similar, although larger tooth of the same name. So let's think now about the upper front 6 teeth. If we divide the face down the middle, we now have right and left sides. So we now can understand that we have 3 unique upper front teeth on the right side and on the left side. So now, starting in the middle of the face, the 2 center teeth are called central incisors. This explains their location and their function. Central incisors. They are in the center and they incise or cut things similar to what scissors do to paper. We can shorten their name and just call them centrals. There are 4 of them: upper right, upper left, lower right, and lower left. Now, in dental school, one of the tests we had to take was to pick up an extracted tooth, study it, and write down which tooth it is. Right and left teeth are essentially mirror images of one another, and the right side of each tooth is different from the left side, more so for upper centrals compared with the lower centrals. Upper centrals are bigger than the teeth just next to them. The teeth next to the centrals are lateral or next to them, and so they are called lateral incisors or laterals. And just like centrals, there are 4 of them. But here's an interesting difference between upper and lower incisors. Now remember, incisors are central incisors and lateral incisors. The upper centrals are wider and really bigger in all dimensions compared with the laterals. But it is the reverse for the lower teeth. Sometimes all the lower laterals and centrals look to be the same width, but most of the time, the centrals are just slightly smaller than the laterals. The next tooth over, and still considered as part of the front teeth, is the largest single-rooted tooth in the mouth. This is the cuspid, or canine. The word cusp is used to designate a point. We find it even in the world of mathematics. And a cuspid has 1 point. The term canine should bring up the idea of the dog with the fangs. In Dracula movies, it's the upper cuspid that sucks blood, I guess. Although I really have no idea the mechanism for doing this through the tooth. Of course, vipers have fangs. They kind of look like cuspids, but vipers don't have front teeth. They just have the fangs. But these apparently retract, and when the snake opens wide, they swing out. Anyway, we have cuspids or canines that have a point, which is really my only point here. Behind the cuspids are the back teeth, and we will get into them another time. Teeth are not white, like white fences, which can be a giveaway that they are not real teeth. The art of creating teeth in porcelain involves a lot of artistry to include the blending of colors as well as the magic of translucency. This is how light goes through an object. The cutting edge of the central incisor, the upper edge, like 1/4 of it, 1/5 of it, should have a little blue in it that is the darkness of the mouth as seen through the enamel. There is no dentin behind this edge, upper edge of enamel, to stop the transmission of light. This also brings up another challenge. Teeth look different under different types of lighting. So, when true porcelain artists and dentists were really good at this kind of work to match the colors of teeth with new crowns, it is common for them to look at the teeth under different lighting, even walking outside or standing by a window. If you go to places where black light is used, don't be surprised if any crowns show up differently from your natural teeth. It's a little weird, but hey, that's black lighting. Here's something else to think about. If you use too much toothpaste, you can polish down the surface of your centrals. At first, when the teeth are very young, there are obvious vertical shallow grooves in these teeth, usually about 3 of them. In fact, when these permanent centrals first start erupting into the mouth of a child, they often look like 3 little white spots peeking through the gums. They're not a sharp edge yet, they're little bumps. Young teeth are widest because the enamel is thickest. As the outer surface wears away or dissolves away from acidic foods and drinks, the enamel becomes thinner. Whitening processes can freshen and even bleach the outer surface, but over time, if too much enamel is lost, remember translucency? The light shines through the thin enamel and hits the dentin and bounces back to the eye, teeth begin to look more yellow because dentin is more yellow compared with enamel. Something else can happen as the enamel thins. Teeth become more sensitive to cold because the enamel is an insulator. Dentin, on the other hand, has microscopic tubules that have fluid in them, and they communicate with the nerves within the center of the teeth. These transmit temperature, and teeth feel more sensitive. So it's important, as much as we can, to keep as much enamel on our teeth. If we get to a point where the teeth become yellow, that's when we begin to think about things like veneers. That's a very thin covering of porcelain that's bonded back onto the teeth. This is not something I do. So here is a brushing tip for you. Use a little toothpaste for flavor and no more. Toothpastes clean due to their abrasive nature, all of them. Wet, soft bristle brushes are usually adequate to keep teeth clean and remove bacteria colonies or plaque that causes most of the diseases we have to deal with. So you could choose just to use wet water on a soft bristle brush, but I don't. I use just a dab of toothpaste for the flavor. Now, disrupting these colonies, these plaque colonies, requires frequency more than intensity. I see a lot of damaged mouths from intense efforts by good people who are attempting to stay healthy. Instead, be gentle and consistent brushing twice a day. Use a little toothpaste for flavor unless you have specific instructions from your dentist, and there are times when other specific recommendations are indicated under specific circumstances. So I'm not trying to override instructions from others. But whatever you do, make sure it makes sense and don't go by feel. A lot of people stop brushing after they have achieved a certain feel in their mouth. Their gums sort of tingle. This is usually way more intense than is needed for health. One more thing to think about. Why a soft bristle brush? I think the softer the brush, the less injury to the gums. Toothpaste causes erosion and abrasion of the hard enamel. Gums recede often because of toothbrush injury. Think about being a thin layer of skin in an area that is injured every day. It can't recover or grow back to where it was. Instead, it will heal in a more protected area further down the tooth surface or root, as far away from the toothbrush as it can possibly be. Here's a restatement of this point. Hard surfaces of teeth are abraded and eroded. Soft tissues around teeth are injured. Abrasion is worsened by excess toothpaste use. Soft tissue injury is the result of toothbrush trauma that can be inflicted even by a soft bristle brush. Here's another interesting thing you might check out next time you're at the grocery store looking at the oral health care shelves. Look for a hard bristle brush, a hard bristled toothbrush. I don't think you'll find it. And that's because people over time have been taught to not brush with hard bristles. So, what are the next hardest bristles available? Mediums. The mediums of today were the hards of yesterday. The names were just changed. Softs today were the mediums of yesterday. So be careful with soft brushes. Extra softs are great, and that's what I use. But you still have to use them gently. Another clue is if you are spraying out the bristles of your toothbrush after a week of use, you're overdoing it. They should last, I would think they should last at least a couple months to 3 months. Be gentle with them. Now, electric toothbrushes, they're great, but hold them gently and use them as instructed. So, I hope you've enjoyed your little time in dental school in the freshman year, sitting in the auditorium in the basement looking at slides. That's what I looked at. Slides of big teeth. It actually was a fascinating thing. It's not the type of thing that most people think about, but dentists have been trained to think about them, as have hygienists and others. So welcome to our world. Final quick review. We've talked about teeth, especially the front ones today, the ones most visible to our eyes and the eyes of others. And we've talked a little bit about how they really look when you study them up close, and finally, in part, how to take care of them. Thanks for listening. This has been the Perio Patient Podcast, episode number 33. My name is Dr. Ben Young. I'm a practicing periodontist in San Antonio, Texas. Please subscribe to hear podcasts as they come out, and of course, have a great day. I used to be a banker, but then I lost interest. Now, go fly.